And while you're doing that, I'm going to introduce Paul. So our speaker today is Paul Teeple of the North Dakota Department of Health. Paul has been on the virtual front lines of the COVID-19 pandemic for, I think, 11 months, probably pretty darn close in a couple days. Today, he's going to share his experiences managing the health department's social media during the pandemic and some of the lessons he's learned along the way. And helping me out today is Jen Rabb, and Jen is the communications director at the Office of Management and Budget. And she's been working closely with Paul and the Department of Health staff during the pandemic, and she graciously agreed to co-host today, taking the lead on interviewing Paul. So Jen, unmute yourself. Paul, unmute yourself. I am going to mute myself, but I will still be here if you guys need anything. Okay?
Sounds great. Thanks, Sarah. Super excited to be here. Good afternoon. As Sarah said, I am Jen Rabb with the Office of Management and Budget, and very excited to get to kind of help lead us through some questions with Paul, because we all can about imagine what kind of what his job has been like over the last many months. And so so having said that, I've gotten the opportunity to work with Paul and some of the great people over at the Department of Health. It's been very eye-opening, and it's honestly just been a real pleasure to work with these very, very hardworking individuals. And so having said that, Paul, before we kind of move into some of the in-depth questions that I have for you, let's chat briefly about, just your background. Tell us a little bit about where you came from, how long you've been at the Department of Health, and then, some of your past experience with social media prior to coming to the Department of Health.
All right, well, I am originally from Cleveland, Ohio, and I've moved all over the country. I've lived in Ohio, I've lived in Florida, Kentucky, North Dakota, and for 10 years before coming to the Department of Health in 2019, I worked in sports and sports broadcasting from team communication side in minor league hockey from 2008 until 2019, where I did the game broadcast, but also every possible aspect of communication, plus the infamous other duties as assigned, so IT, garbage man, vacuum guy, whatever the team told me to do. So that was my story for a long, long time. And I have a degree in broadcast news, because originally when I got to college, I thought I was going to do TV sports, and it never wound up going that way. But as I progressed in the world of hockey, it became more and more apparent that I needed to do communications as well. And it turned out that I was all right at that. So it wound up being a career change in 2019, where I came to the Department of Health in the middle of the year. Never quite expecting all of this, to say the least, but at the same time, not ill-prepared for it either, between my previous experience and also tons of good training, FEMA, and amusingly, the day that our operations center was activated, I started a first of 2-day courses with Rob Keller, who's with us today. And it turned out that was a nice little segue into what the next year or so would be of my life, and continues to be.
Shameless plug for Rob and some of those awesome courses that many of us on this call have been through. If you haven't, go check those out. Maybe Rob can give us a link or something in the chat. So, so moving on a little bit, Paul, can you, so Department of Health obviously has, several social media accounts that you're using. Could you talk to us a little bit about what you had pre-pandemic? Is there anything you launched during the pandemics just solely to, to be able to get to people during the pandemic? Tell us a bit about your accounts that you have.
Right before the pandemic happened, I should say, we launched Instagram. We had pre-existing Twitter, had pre-existing Facebook, and launched Instagram maybe 3-ish weeks before our operations center got elevated to level 1 and the State Emergency Operations Center stood up. And that account had maybe 200 followers when it started. And so there wasn't anything that we started per se in response to the pandemic, but Instagram went from almost never used to, because we had reserved the name maybe 6 months before, but never actually posted on it until about February. And then we went from just a very, very small handful of posts to between 3 and 5 posts a day on it, depending on kind of how heavy how high the heat was in the pandemic. Early on, we posted more, ramped down in the summer, and kind of kept it a steady 3 posts per day, unless there were some emergent things. But nothing necessarily new, but one new frontier kind of happened at the same time, purely out of coincidence.
So talk a little about your typical post, or how, I know you said you kind of talked about how often you were posting on Instagram, but talk about like, what was your typical post pre-pandemic versus during the pandemic, and how often did your posting change on your Facebook, for example?
Facebook, I would say we probably had 3 to 4 posts a week. We wouldn't post every day, and we would post when programs had something new, or we wanted to refresh something about a program that we wanted to put back at the top of mind of our followers. But posting to social media was pretty infrequent for us. And from there, as I mentioned, we jumped up to 5 posts a day by the middle of April, and eventually kind of tilted down a little bit again in the summer, and have since then kind of kept at a steady 3-ish posts a day.
How have, kind of along the same lines, how has your number of followers changed? Do you have numbers as far as like what it was pre versus during versus now?
It has changed hilariously, I would say, because when we started, the day of the emergency declaration from Governor Burgum, we had less than 200 Instagram followers, 1,000 Twitter followers, and about 7,000 Facebook followers or likes. And now we have 8,000 Instagram followers, a little less than 9,000 Twitter followers, and 117,000 Facebook followers. And so the numbers just went absolutely bonkers. Pretty much from the start. I think we hit 100,000 late summer, but we are following on Facebook in particular because, as I'm sure most folks know, in North Dakota, Facebook owns social media based on demographics and everything like that. They quadrupled in like a week after the emergency declaration, especially from the press conference with Superintendent Basler that announced the plan for the schools. And from there, our numbers just...
Is there a particular post that you can think of that had the largest reach? Do you know what that was?
The Facebook Live of that press conference I just mentioned was pretty big. It had about 1.5 million views.
Wow.
But the biggest post that we've had was from the very beginning of September. Our state epidemiologist did a fact check video when the news came, or when the rumor came out that only 6% of the COVID deaths were actually due to COVID. And we had her do a brief video debunking that. And it went from, I went to bed that night and it had 4,000 or 5,000 views. I woke up and it had 1 million views. I don't know what happened, but it went bonkers. And as of Friday, I checked, that video has 11 million views, which is, it's hard to really wrap your mind around something like that. But that post itself is responsible for about 20% of all of our reach for the entire last year.
Wow. That's not just like North Dakota viral, that's like viral.
Mm-hmm. And in fact, most of the comments weren't from in-state, so it definitely escaped our borders for sure.
Yeah. So talk a little about some of the lessons that you've learned throughout all of this. Some things you could kind of touch on are like, the post content, throughout how did your post content change based on things that you were learning, the reposting of things, managing comments. If you could kind of touch on some of those things, Paul.
I think coming in, reposting things was extraordinarily rare for us. Almost all of our posts were new content, and there have been times where we've been trying to stick to that, 3 posts a day, where there might not have been content. And Jen, I definitely have to single you out, because at the beginning of the pandemic, while the JIC was still this enormous 70-person undertaking across 25 state agencies, Jen was the one who was going out finding stuff to help us share, looking at the World Health Organization, looking at the CDC, looking at other states for best practices and stuff. And that's one of the things that we've really kind of dug into a lot, where we would share from other organizations, but also just repost. I think we have about 4 solid posts about the use of masks and face coverings that we've been using for about 2 months, rotating about 1 a week when we can. And they still get 50,000 reach every time you post it. And it's not necessarily even the same commenters, the same comments, still gets a lot of likes, still gets a lot of shares, because it's not necessarily something that we learned, but definitely had it reinforced that it's not always the same people that see it. Facebook and the algorithm might be the same people who see some things sometimes, but Facebook or Twitter, and Instagram, once it goes down the timeline, it's gone, especially Twitter in particular. So reusing the same content didn't really have any downsides. And in fact, it helped make sure that the message was reaching the right people without really fatiguing them with the same stuff over and over and over and over and over again. Same thing, we paid to have the ping pong ball and mousetrap video that the Ohio Department of Health used. We loved that video. We asked them if we could use it, and they hooked us up with their production house, and we paid a fee to them and got it for ourselves. And we use it probably about once a month right now, because it's a really compelling and effective video. And there hasn't been any sort of wear down or fatigue. That's the word I'm looking for. With stuff like that. The one nice thing that I had coming from the world of sports that I was able to kind of bring in was that when you see replies and comments that are hostile, it was very easy for me to just kind of laugh it off or ignore it. And I think that may be personality based. I'm an extremely online person, so seeing stuff like that never really affected me, but that was a bonus that I had. But at the same time, I did find myself wearing down. This is more of a personal thing than kind of a practice thing, but I think it's important, is that time off is helpful. And Jen, you know this. I worked 322 days out of 324 between March 8th and 2 weeks ago. And my only days off were Christmas Day and New Year's Day before the last Monday, Tuesday, and Wednesday of January. I just didn't take time off. The social media was a daily thing. It was needed. And when our team shrunk down by the end of June, it was me. And so I kind of put it on myself, and it never really bothered me. But by the end, there was things in my normal non-pandemic job that I was missing. I was tired. And so I did take 3 days off and finally just kind of mentally reset myself and sat on my couch and did absolutely nothing for 3 days. And it was glorious. But burnout is a real thing. And I've talked to some of my friends in the sports business who say the same thing, that social media burnout can be such a thing when you are putting it on yourself to create this content all the time, and understanding that it is an awesome megaphone, and it's one of the best ways we have of communicating, but at the same time, not trying to kill yourself to do it.
Yeah, that kind of just like mental aspect is huge too. And, I did tell you to take days off, just for the record.
You did, repeatedly.
I did. But,
So did everyone.
That is actually one of my questions to you is, how we talk about there, obviously the pandemic has become a very political thing. And so there's people that feel like they're on both sides of every single little thing that has to do with the pandemic, from masks to social distancing to, yeah. Not getting into the political part of it, but because of that drives a lot of really negative comments. Could you get in depth a little more about how you mentally, dealt with that, as well as, did you guys at the Department of Health end up putting in any sort of policies to deal with those, or were you just like, it's too much, we can't handle it, we're just going to let it go? How did you personally, deal with it? And then how did the Department of Health deal with, having all these negative comments on pretty much every post? Can you talk about that a little bit?
Yeah, and for the first part of that, it kind of became a natural thing where I would almost kind of just sift through the comments. Because one, after about 2 weeks of this, you start to understand who the people are who are going to come onto your page and say nasty things one direction or the other. And for me, once I understood who those people are, and if I sat down for about 10 minutes and thought about who those people are, I could name about 20 of them on a rotating basis between last March and now, who, when they would come on and post something, I would just kind of, as long as it was within our comment policy, I just kind of nod my head and move on, because some people are really entrenched in what they believe and want to yell about it. But the big thing is not getting too wrapped up in it, not freaking out that somebody's saying something angry, because there are people that are angry, and this has been such a disruption to life and such a disruption to what we've been used to through all of our lives. None of us, I assume, none of us have been around long enough to remember the last pandemic like this 100 years ago. So we haven't lived through this. There's nothing like this that we can compare it to say, okay, here's how this is going to go. We have a touchstone to kind of look back on in our lives. So everyone's freaked out. Everyone's afraid and wondering, how do we get through this? What happens next? So taking anything like that personally is a way to burn yourself out even faster. So personally, I just tried to kind of understand who the extreme people were and just kind of, okay. And then the other thing I would kind of look for is, see, there are people on both ideological sides that would be upset about posts. I figure, all right, if both sides are really angry about something, I'm probably in about the right spot. And I'm sure that I'm not the only one who's kind of had that thought occur to them over the last year or so. But the one thing that was nice coming into the department is that we already had a pre-existing comment policy. And for us, it was no profanity, nothing obscene, and no links, no graphics. Graphics are just straight up blocked by Facebook in our settings, and links that weren't to government sites weren't allowed. And there's also a stipulation where if you post something off topic, it could be hidden. I don't think I've used that more than once to hide something. And really, the big thing is that I only hide things that go against our comment policy. And mostly it's links. And it's really easy to find out because the same people come on and they post the same link to Facebook 14 times. So just hide. And we're keeping an eye on the case in Missouri that was just reported on yesterday, or not Missouri, excuse me, Montana in Missoula, where a gentleman is suing his local police department for hiding his Facebook comments as a violation of First Amendment rights. I spoke with our legal folks and forwarded it on to the AG's office just because it's interesting and important, but we feel that because we have a clearly articulated policy that we're okay to hide things as long as they're in violation, but not just like vague criticisms or people angrily yelling into the void. That's just Facebook. And if you're not expecting to see that, you're on the wrong platform. But having the policy was very, very helpful because we didn't even have to change anything. It was already in such a good spot that we just had the rule and applied it as it went forward. And no one could really even say anything because these have been the rules for years.
Well, you'll have to keep us all updated on what legal comes back with about that. I'm very curious about that as well. I hadn't heard about it. So Becky in the chat says the rest of us shared your awesome posts. So thanks, Becky. I assume you're thankful.
And I'm pretty sure we got some posts from Becky too. So.
And along the lines of posts, Paul knew this question was coming. I told him that I might ask about this just because, having, been able to work with him at the beginning of all this, especially, I know that our daily graphic updated throughout over the course of time. So could you, maybe if you want to screen share and show him a little bit and talk us through how that changed, and maybe not just that graphic, but in general, if there's anything else about that post or other posts that you like a lesson learned, like we should not use this kind of language, or we shouldn't say that, or maybe if you could share a little bit of that for us too.
I'm struggling to share my screen. It looks like I'm disabled from sharing screens, but
okay.
That's all right.
Sarah, you there?
If we get that enabled, cool. If not, I kind of was looking through this morning anyways. We've gone through about 10 or so changes to our daily report graphic. It started on March 16th. And our first iteration of the graphic, because we started for the first month or so of the pandemic to report twice daily, once at about 9 or 11, that changed a couple times, and then once at 4 o'clock before the governor's daily at the time briefing. And then that went to once a day. So our posts went down from 4 a day to 1 day. But our first concept lasted 2 days. And then we moved on to a new map. And I was kind of looking through the timeline of this, and there were, between the middle of March and the end of April, 4 different iterations, of daily report graphic. And then we came up with a format on April 25th that kind of stuck until the middle of July. And then from the middle of July to the middle of October, with the redesign with the map, as you see, Jen's got it shared up right now. Then in October, we changed the active map to a different color. We were getting a lot of comments that the green color made it seem like things were safe. And by late fall, we were hitting the height of our numbers in North Dakota. So I changed that over to more of a yellow, red, orange to kind of reflect the severity of what was going on. And that format lasted until about 2-3 weeks ago. When I changed it, the only change really was to change the number of total tests to vaccines as the vaccine rollout really started to ramp up here. And the only other change we had, you see the December 26th one, we started not doing reports on the weekends. That got a little bit of angry responses. I even had some people I know personally create some conspiracy theories about that, which was interesting, but we stopped doing weekend reports. As the numbers went down and down and down, we knew that we were going to have to eventually transition. So we kind of saw this is a holiday weekend, numbers are low. We're going to take this opportunity to discontinue our weekend reporting to ramp down how much we're working on the weekend. I was putting in 4 hours a day on the weekend even until then. And now I still work on weekends, but I work maybe an hour or two on Saturday or Sunday. And it's much less high stakes to not have to remake a map manually to have out at 11 a.m. Because believe me, if that map's not up, we've had some days where there have been technical problems with our dashboard or whatever. We didn't have the numbers weren't right. We needed to fix them before everything launched. So it wouldn't come out till 11:20, 11:35. And man, if that's not out by 11:10, we start getting messages. People are ready to have that out early in the 11 o'clock hour. We've only said it comes out in the 11 o'clock hour because if we marry ourselves to 11, we open ourselves to even more people saying, it's 11:01, where's the map? But I mean, as you can see, it was kind of a trial and error. And even the first 3 or 4 was while the Joint Information Center was still operational in the Department of Emergency Services basement. And I was down there with Nicole and Rob and Maxine and our intern Jesse. And that was a lot of brainstorming of, does this work? Doesn't this work? I was really fortunate to have some really strong, communications brains down in that basement with me to really kind of shape the map for the first 4 months of this. And then be able to kind of refine it as I went along. But as you can see, the timelines kind of stretch out the later in the pandemic with how long a certain format was able to last. Because for one example, the April 2nd to April 16th one, we would have every single case, what county they were, their gender, their age, and how they were infected, whether it's community spread, close contact, household contact, so on and so forth. And it got to the point where that was cool if we were doing 12 people, 12 new cases a day, 20 new cases a day, but we were getting to the time when we were getting 40 plus new cases a day, and it was taking up too much space to even have the 4 graphic limit that Twitter would impose on you. So we knew, okay, we kind of have to rejigger how this is going to work. So that's when we went to the graphs and things like that. Sometimes this is just plain old born of necessity, and sometimes it's just new things that are important. In April and early summer, total cases were important, but active cases became more and more important. So in mid-July, boom, changed it to the active case map. Now, on January 28th, vaccines were more important than the number of tests done. So we switched in the vaccine. So it's kind of trying to evolve as much as possible while staying flexible as well.
Yeah, and it kind of sounds like your changes were both driven by citizens and just some of the feedback you were getting on colors and various things, as well as internally driven based on maybe pandemic numbers or, just how you're seeing a better way of projecting those numbers.
Yeah, and we didn't want to feel like we were rejecting the feedback of the citizens. And in a lot of cases, like with the green map, while our numbers were getting bad, they were right. And so it was one of those things where, okay, let's sit down and figure out the best way to do this. And honestly, the green map happened because if you look, the map before was also yellow, orange, and red, but it was a different set of information that was being presented. That was total cases. The map changed to active cases. And anybody who works in our state government knows that we're restricted to, 11 different colors that we can really use because of brand standards. So I was kind of handcuffed a little bit if I wanted to kind of make sure that people understood that this was different data being presented. So I switched to the green palette simply just to kind of subtly reinforce this is different data that we're showing with this. But yes, as we got into the fall and mid to late fall, numbers were bad that green didn't really make a lot of sense. So we took that feedback and made the appropriate adjustments to it.
So, kind of along the same lines as far as best practices go, we actually have a question in the chat, and everyone, make sure that if you have questions, put them in the chat. We should be able to get to them before we're done here. From Rob, and he says, as you look back and evaluate the pandemic and narrative, what would you do differently, if anything?
I'm not sure I would do anything differently. I think obviously there are little things that haunt me because I have that sports brain where I don't remember most of the wins, but every little loss sticks in my brain for 30 years. And so there were days where I put the wrong county shape with the wrong name for the county. I put, Morton County with Renville County or something. Or just this past Saturday, I copied and pasted a post from the CDC and didn't notice that the post said outdoor parties are safe. Well, when it's minus 20 degrees, outdoor parties aren't really safe. But yeah, I'd like to have that back. But I think conceptually, kind of big picture, I'm really proud of the job we've done. I think that between operating in the Joint Information System and then kind of being more on our own and moving into a much smaller team, I think we are all very happy to kind of stand behind the work we've done and how we've done it. I think it's been very fair, very informational. And we took advantage of the time we had early on to be a little cheekier, a little folksier with our posts, have some fun posts. Amber at Housing Finance made some really funny posts. I tried to make funny posts. I'm not that funny. But when we started realizing that deaths were not so much an outlier, we kind of made our mood a little bit more somber. We didn't really have as much fun because it's not fun. It's serious stuff. So we did our best to kind of walk that line until we just knew it was time to get more serious. But overall, I'm very, very proud of the way we did it. I don't think I would change very much.
I have to second what you're saying. I think you all handled everything really well. This is a very, we keep hearing the term unprecedented, like, obviously, right? None of us have been through a pandemic before. And so considering that, what an amazing job. So, what have you had to put aside for duties, since this, you talked a little bit about that earlier, but, obviously you've been living and breathing this pandemic now for the 11 months that it's been here. What have you been not able to do because of your time dedication to pandemic comms?
Well, two of the things that I was originally hired for included plan review, which was evaluating the communications aspect of our emergency plans, which I had just started to do probably 2-3 weeks before the pandemic started. And now we're going to have to rewrite everything anyways with the after actions and everything when we come out of this. So the timing of that was very amusing. And I know Jennifer Skay is in here, and thank God that she had all those binders in that office ready for me to grab, because she did an awesome job before I came in and helped me be ready for that. But the plan review certainly has fallen off. And one of the big things that I had established in the Department of Health is we had a daily video blog where I would go around and have different people in the department, which before the pandemic was about 250-ish people. And I go to different buildings, different offices, and have people talk about something important going on with their program. And in a department that had 3 different buildings, a lot of different divisions and offices where people would just not see each other outside the annual meeting, it helped people kind of understand the mission of various divisions, various sections a little bit better. And it was a really fun project that I did that once we activated went from every single day to 3 times a week to once a week to being paused. And that was in early March that it got paused, and we haven't been able to pick it back up yet, which stinks, but it obviously is the nature of the beast, because we've been able to divert that focus for now and turn it into this great big megaphone that's been important for the pandemic, obviously, but going forward, now all of our programs and partners and such have such a bigger platform now to be able to release their information after we're out of this, obviously because of our big boom in numbers.
So we have a question in chat from Chelsea, and she asks, what does your team look like today? And what does your workflow look like? So I'm guessing she's probably trying to compare that maybe pre-pandemic and beginning of pandemic versus what it is today.
It's definitely kind of been a roller coaster, because when we started, our communication staff was me and my boss, Nicole Pesky, and our multimedia wizard, Clint Fleckenstein. And that was our team. And we had very kind of uniform, it's over there, I'm not going to reach for it, but it has just very uniform, and it's got old logos. So it's a very staid and well-established workflow that on March 13th went boom. And so when the State Emergency Operations Center was stood up, our team got huge. As I mentioned, we had the Joint Information Center that had, I believe, and Maxine or Rob might remember, we had about 70, 75 people in that from all manner of state agencies. My team wound up being myself, Jen was on it, Amber from Housing Finance was on it, Jay from the National Guard was a part of it, Alicia from Commerce was briefly part of it as well. And we tried to kind of come up with the best messaging possible. Amber did such a great job with graphics. Jen was a bulldog on finding good national and worldwide information for us to share. So our team got up to be, 4, 5, 6 people, I think, by late April or early May. And it stayed that way until early June, when the numbers started going down a lot, our team went back to pretty much the health department team. Amber, and I should also say Kayla from Housing Finance also helped us by responding to comments and questions in particular to our Facebook inbox. So our team went from 5, 6, 7 people down to me for social media, from June until kind of now. I have a backup. One of our temps, Luke Askew, has been backing me up with for social media, but he's only had to do that a few days because 2 of my 5 days off were holidays where everyone was off. And so Luke backed me up in late January when I took my 3 days off. But past that, it's been me. And I've made the graphics, I've made the post, but I'm not saying I do everything, because I still get tons of suggestions, tons of content from folks in the department. We have a daily leadership meeting that I get to sit in on. I'm hardly leadership, but the leadership meeting I get to sit in on and kind of grab ideas from that on what's important, what's going on, and people will let me know, oh, here's something important, and we'd like to get this on social media. But in terms of the graphics and posting and all that stuff, you're looking at the team right now. So it's been it's been a lot.
Roller coaster for sure. I will add to that I think one great thing about the health department is how they value communications. You don't necessarily see that at every agency or business or wherever it is that you're working. And both the Department of Health values communications, as well as Unified Command understood the value of communications and getting the right messaging out from the beginning. Okay, I know the answer to this because you've already kind of touched on it a little bit, but you kind of helped me segue into one more question that I had for you, which is, what assistance or support have you received? So you kind of talked a little bit about that, but maybe you could tell a little bit about, what agencies have been there to help, how that JIC looked at the beginning. Do you happen to know how many agencies and or local government folks were represented aside from the 70 count? Do you know how many individual agencies?
So there were 25 agencies from across the state that had their team members join the JIC by the end of March. And on top of that, there were a lot of counties, cities, and the local public health units continue to be a big part of it, obviously, because they're the boots on the ground. So we've been able to work at a lot of different levels with a lot of different folks. Obviously, with ourselves, Department of Health, the governor's office, emergency services, and the Guard have kind of been the tent poles for Unified Command from the beginning. So our agencies have had kind of the biggest lift, but it's definitely been a full team effort. Every agency that I could probably name off the top of my head has helped out with communications in one role or another. And I remember Maxine brought in the org chart in the middle of April, and it was this big giant, it looked like she was unrolling a Torah. It was so big. And it was just kind of really indicative of how many people came together to help really get this response going when it was just so many unknowns and so much kind of weird and crazy stuff that we just didn't know everything about yet. We don't know everything now, but we certainly know more. But the way that everybody came together was really dang impressive.
Awesome. Make sure if you have questions, you get them in the chat. This is your chance to pick the brain or just ask questions of somebody who has been in the thick of it for 11 months here. I do have another question for you, Paul. What are you hoping for out of life after COVID? So I mean that both personally and professionally. Like, what do you see, in the future for you, for your position, and in life, for all of us? What's your vision?
I mean, I'd really like to leave town. I think that'd be a great start.
Wouldn't we all?
No, I think personally it'd be nice to have like weekends again, because I am not complaining by any means. If I wanted to take weekends off, I could, but I don't want to, because I know what we're doing is important. And even if it's minimal kind of maintenance work on the weekends, just being able to make sure that that stuff gets out there and gets right as much as possible, CDC cut and paste notwithstanding. But being able to kind of get back to a normal 40-hour work week, I think will be splendid. It'll kind of ramp down a lot of the stress and the anxiety, I think, that goes along with something like this. So just personally, that elusive normal that people keep talking about like it's a unicorn, I think it'd be nice for everybody. Certainly not just me. That is hardly selfish. I think we're all looking for that and wondering when and how. I think professionally, obviously, I wasn't brought in necessarily to manage social media. I wasn't brought in as like a digital content person, but I kind of evolved into that. I imagine that's going to stay that way because we have this great big megaphone now. And even when COVID fades in the background and it becomes the same kind of messaging that we would do for a flu season, probably is what I imagine, because we know it's a virus, it's a coronavirus. There have been coronaviruses of different kinds for centuries, but cold season, flu season, and things like that. So that's what that messaging is eventually going to fade to, but we still have this big platform now. And I've already been working with our programs, kind of urging them, saying, look, we've got this now. Let's use this so we can advocate for stuff. And if you've watched even over the last week, we've had a lot of child passenger safety stuff, had injury prevention things as well. I have this whole column on my board over here of the things that we can do, and we still work interagency as well. Human Services sent me something on Thursday saying that they had this announcement that they wanted to make sure got a wide audience with SNAP, and so we shared that out on Sunday. So that kind of is going to become a much bigger thing going forward, I would imagine, because it's turned into such a big part of our communication. It's our biggest tool now, I think. I don't think that I'm being braggy about that. I think that it's just very objectively our best way of getting stuff out to the public now. So we got to kind of lean into it.
Well, thanks, Paul. Is there anything that you kind of wanted to get across, or a point you wanted to make, or something you wanted to share that you feel like we've missed?
There's probably something in my brain that I've already forgotten at this point because it's going to be a while before my brain gets back from like that thick soup composition that it's been since about May. But I think overall, it's just been really rewarding to be able to know that we've been having fun for the most part, but being able to kind of appropriately deal with something that's really serious and affecting a lot of people without being too pushy and too naggy or anything like that. And really, when I say we did our best, it's not, one of those things, we did our best. We really did our best. We're really happy with how things have gone so far. And my biggest hope is that we can continue that way.
Yeah. I do have one more question here that just came into the chat from Maxine. How do you stay on top of the changing world of social media? Great question. So much all the time. Sometimes I feel like Facebook makes changes every day, or algorithms mess with us, or videos should be X length, etc. Without opportunities to attend conferences now, other than virtually, and sometimes not, maybe a change in dollars. How do you stay on top of the trends and changes? That's a really
one thing that I do constantly, and I think this is just part of, as I mentioned, I'm extremely online. I have Twitter brain poisoning for about 10 years at this point, but I'm constantly best practicing stuff and talking to people who do what we do and trying to stay on top of things. One of the biggest reasons that our platform blew up like it did is live video. Live video is king right now. And so Clint and I were ready when the governor's office called us on March 13th and asked us to come stream that. Governor's office does their own live streams now for things, but on March 13th, we were the ones that were ready to go with it, and they called us and we stuck with it. We became the place to go for live video. And I would have never really thought of that had I not been talking to friends and colleagues who were telling me about, and this was maybe even a year, 2 years before, about how the platforms are so huge on live video that they promoted in their algorithm, Facebook most of all. In fact, they might do it a little too much. I remember they got sued about this a year or two ago. But overall, just kind of staying on top of what works, what doesn't. It's one thing that I learned late in my sports career and early in my government career was that if you have a naked post, a post without a video, without graphics, without a link, Facebook's going to laugh at it and kick it into the sewer. So there's always got to be something with it, because so if you look, we haven't had a post in this at all, period, that's just been text. Every post has something on it, which has been able to kind of keep our numbers beefy as well. But again, it's just networking, constantly best practicing. And that's a really fancy way for me saying that while I'm watching TV with my wife, I'm just, but that's what it amounts to.
Well, thank you, Paul. I think we're, you can take a look at the comments if you get a second, because there's some thanks coming in and some praise for the work that you've done. And I personally, just want to give you a huge, huge praise and a thank you for all that you're doing to keep us all informed throughout all of this. Hopefully, you know how valuable you are to all the citizens, but also just to the state as an employee.
Thank you.
And with that, Sarah, I don't know if you have any other, now take a week off.
I just have brief wrap up comments. I wanted to reiterate our thanks for Paul for sharing today, and Jen for co-hosting and leading the discussion. I wanted to let everyone know the FEMA training information did get posted in the chat. If you're not familiar with that, one thing that wasn't included in the chat that I wanted to point out to you guys is it is free. So there's no reason why you shouldn't sign up for that. I think a lot of us have been through it, myself included, and it is well worth the time. You will learn so much even in the beginner course in those 3 days that no employer should shy away from sending you to a 3-day training, because it's well worth it. Rob does an excellent job and the content is very good. So and if you're not familiar with where to sign up for that, you can reach out to me. I can connect you with Rob. You can also try to monitor the Department of Emergency Services website. They post, or their training information is in there, and I think the dates are in there for the basic course. Rob did indicate that the course name is going to change a little bit, but it's going to basically still be the same content. And then if you have participated in the beginning training and you're interested in the advanced training is going to be, I believe it's August 9th through the 13th. So just if you missed it in the chat, I did go back and count, like Paul had indicated, Facebook rules in North Dakota, and 6 of you indicated that Facebook was your favorite social media platform. 4 said Twitter, 2 said Instagram, and we had 1 TikTok. And I feel a little bit better about myself because I know all those platforms. So finally, if you are interested in learning more about North Dakota Professional Communicators, you can visit us online. You can Google North Dakota Professional Communicators or find us at our website address is aboutndpc.org. You also are welcome to reach out to me. I work at the State Housing Finance Agency, and as all communications people, my contact information is pretty easy to find, and you can always just send an email to the info account because I'm the one who monitors the info account. So thank you everyone for participating today. And again, thank you, Paul and Jen.